Greetings, everyone, and welcome to a discussion on the potential of AI technologies for healthcare.
Before we dive in, allow me to introduce myself, although that phrase may take on a surreal meaning today.
I'm not the real speaker, nor did the real speaker write this introduction. The voice you're hearing, the image you're seeing on the screen, and even these introductory words were all generated by AI systems.
We are actively amidst the arrival of a set of disruptive technologies that are changing the way all of us do our work and live our lives. These profound capabilities and potential applications could reshape healthcare, offering both new opportunities and ethical challenges.
To make sure we're still anchored in reality, however, let's welcome the real-life version of our speaker.
Take it away, Dr. Jonathan Chen, before they start thinking I'm the one who went to medical school.
Thank you for that kind introduction. That was weird. I don't know, Dr. Thomas, at this point, do we even need to be here? I'm pretty sure AI could just give our presentations for us at this point. For you watching online, how do you know I'm not an AI-generated avatar right now? I certainly hope and wish AI systems will let us manage the overwhelming flood of emails and in-basket messages we have to address every single day, develop new paradigms of care to reach our patients, as well as new forms of learning and training that would not have been possible before. You gotta frantically run on being a physician, a scientist, an educator. I'd run from the hospital. I'm still my white hood and scrubs. I didn't have a chance to change. Give me a second. I think you had a blood stain on this thing. Let me see if I can just clean that up a little bit. Okay, I think we're a little bit more presentable now. There we go. Now we can dive into it. Very recently, Bill Gates gave an interview. He said that within 10 years, AI will replace many doctors and teachers. Humans will not be needed for most things. I don't know, folks. The gauntlet has been thrown. What do you think? What do you think is actually needed or not? For better or worse, good or not, ready or not, realize even if you're not using these tools and systems, your students already are. Your children already are. 90% are already doing their homework, their take-home exams, without even attempting to edit robot-generated content. What are the implications for that? Have you seen this story? A university professor, he failed his entire class. They submitted essays. He said, ChatGPT, did you write these essays for my students? And it turns out ChatGPT really likes to agree with you. So he said, yes, I wrote all those essays. And so he failed all his students. So instructors, don't do this. Don't do this. That is not how this works. It does not work like that at all. There is no reliable detector for AI written content. What does that mean for actually how you evaluate students? First of its kind story, very recently, a PhD student, a graduate student, was expelled from his university. The faculty believes he used AI systems on one of his take-home quals exams. He is suing the university, and the basis of his argument is you cannot prove it. There is no way you can prove what I wrote was AI generated or not. What do you think? It's actually really hard to tell. There is no definitive way to do it. Interestingly, this was one of his homework assignments, the last line. It says, in the L1 stratum, the perfect match, and at the end it says, rewrite it, make it more casual, like a foreign student write, but no AI. This is the world we're living in, and it's a very bizarre and dynamic one that just doesn't make sense the way it used to. The things we used to do just have to be rethought. I don't know if I'm actually helping the situation. These are many headlines in response to a research study we did last year. AI defeats doctors at diagnosis. I definitely would not have picked that headline myself, but it got a lot of very angry people to click on the article, so what am I supposed to say? What does it mean now when AI can already answer many complex medical exam type questions we used to evaluate our students on? It can pass business and law exams. One educator said, this technology must be banned. Many educators at Stanford said this 2 years ago too. Ban this technology. Don't let our students touch it because we don't know what it means when this thing can answer the questions that we used to evaluate them on. After all, when you give somebody a medical degree, you want them to know medicine, not how to use a bot. Is that, what is it you give somebody a medical degree for? What actually is it you want out of them? It's something we really got to think about now in a way we never even had to before. What is it that makes a doctor a doctor? Which begs the question, how do you get humans and computers to be in the right respective roles? Which begs the question, what should we be teaching and training people in? Let's dissect that over the course of the afternoon. Is it knowledge? That's what we used to think. Is this our medical knowledge? How much of the stuff we know? Empathy and kindness? Many people instantly react to that. I actually think that's an incredibly weak argument if that's what you think makes a doctor, because easily replicated, if not by a non-human, certainly non-physicians can do that too. Is it just assuming liability, just let somebody, you have somebody to sue? I don't think it's just that either, so let's think about it. The broader point you have to think about in this context is you must realize not just where we are, but where we are going. The future is moving really fast. This is a chart showing over time how well different language model chatbot AI systems have done in answering medical questions. And I had students working on this 6 years ago. At the time, it was like 35% accurate. Oh, whatever. It's unusable. I stopped paying attention to technology for years, and then what happened 2 years ago? ChatGPT exploded onto the scene. Whoa, GPT 3.5, it could kind of just barely pass 60% accuracy on a medical exam. Some of my colleagues lament, it's like, that's pretty neat. If you want a doctor who barely passed medical school, you can talk to this chatbot. This thing's not smarter than me. And I thought, boy, is that the wrong way to think about this. A few years ago, this technology was unusable. Now it's kind of barely passing. It really isn't that hard to project where we're going in the not distant future. And indeed, a matter of months later, MedPalm 2, GPT-4 emerged, and it can handily pass this exam, outscoring your average doctor. And by the way, this chart is so out of date. Now we have reasoning models, DeepSeek, O1, they just crushed this benchmark. The test doesn't even make sense anymore because they're all basically getting near 100%. Then again, what is this? A bunch of multiple choice questions? Ain't nobody's job is to answer multiple choice questions all day, except for the medical students. That is your job. Just keep doing that. In real life, we have to deal with complex, open-ended reasoning, nuanced decision-making, yeah? So some of the people in this room helped drive this study. The real test we give Stanford medical students, we give them these complex case vignettes, relevant information and irrelevant information, just like in real life. Part of the job is to figure out, can you put the story together so it makes sense? And we didn't ask multiple choice. We said, summarize the case in 200 words, explain your reasoning, define a diagnostic schema. And the key thing we have here, why I think educators actually have the key to unlocking the next phase of AI, is we have the rubric to grade this. Computer scientists like multiple choice because it's easy to grade, but it's divorced from reality, so it kind of doesn't matter. But complex, nuanced reasoning, we have a way to think about how do we give feedback to the students so we know if they're doing a good job or not so they can advance to the next way. So we tried this, and this was the score distribution for GPT 3.5, the first version of ChatGPT, on these open-ended medical reasoning exams. And the red line is passing. Wow, that thing could like barely pass even an open-ended reasoning exam. We were in the middle of getting this reviewed and published. The peer review cycle can't keep up with the pace of technology right now. The editors, we didn't have time for peer review. Shocking results. Already tweaking the wording, trying to get it through. And then, I believe it was March 14th rolled around. The editor sends us email. Oh, guys, sorry. Your paper is now rejected. GPT-4 just came out 2 days ago. So this study that you raced to get out, how many late nights were we up trying to push this thing through as fast as we could? Study was obsolete within 3 weeks of submission. I give you this anecdote to underline the really bizarre pace of technology moving out. We're right in the middle of this disruptive wave. It's like the internet just got invented and then some, and where human institutions cannot keep up that fast with how things change. Redid the whole study, and here's GPT-4's score distribution. It handily passes this exam. It's not even close. It's not even close. For some context, here's a GPT-4 in the red again. In the far right, that would be Stanford medical students. Hey, everybody passes. Eventually. But here's the question for you. What is the point of this test? Really, what's the point? You're going to take this test next year, and you're going to be so annoyed why they won't just let you use AI in it, because it's just so obvious it would help you. What is the point of this test? It's supposed to be to evaluate whether our students have learned and have demonstrated sufficient medical knowledge to be allowed to see real patients. Why do we even have this test when a fully automated, publicly available chatbot can handily pass this exam on its own? In fact, it outscores our average student by a couple points. You're going to see this and many more examples like this as systems emerge. AI can do this, AI can do this. Oh, wow, so impressive, so amazing. But also, it's kind of irrelevant. Because no one's going to let a robot take care of a patient. Yet. So the much more relevant question is, what happens when you give humans access to such tools and technology? Does it actually change their behavior? So we did this study, and several more to follow, but I'll just highlight this one. Randomized controlled trial, real doctors, complex diagnostic cases, and it's not multiple choice. It's like expert consensus grading, explain your reasoning, justify why you made your differential. And we randomized half of doctors. You can look up anything on the regular internet you wanted, right? Up to date, Google, PubMed, just don't talk to an AI chatbot system. And that's their score distribution. They actually do pretty well. Human doctor who has access to the internet is extremely difficult to beat on a knowledge exam. That's been the case for decades of AI informatics research. We randomized the other half of doctors to have access to GPT-4, one of the latest chatbot models, and found didn't actually do that much better, which is weird. That is not what we expected when we did the study. Because it turns out if you ask GPT-4 by itself, it actually outscores all of the doctors, including the doctors who have access to GPT-4. It's a very weird result. This really flies in the face of the fundamental theorem of informatics. Human plus computer, when combined, will deliver better results than either would alone. Doesn't that sound so good? That used to be my closing line at the end of my talks for years. I don't say that anymore. I'm kind of unsure now. I don't know, this human in the loop in the middle kind of seems to be slowing the computer down. Like, could you just get out of the way and let the robot take over already? Is that what this means? What do y'all think this means? Think about that. We'll get into it for the whole afternoon. Some of it really is like a calculator is just better at calculation and you should just let it do that. Other part of it, it's education. A third of the docs who did this study, they had never touched a chatbot before in their life. Another third maybe used it once or twice. They clearly just didn't even know what the thing was and did not know how to use it effectively. A lot of them were treating it like a search engine. They just did not realize you can copy and paste in the whole vignette, you can ask follow-up questions. They did not know what it was and how to use it effectively. What do you do in this day and age? Does human intelligence serve any purpose anymore? I wonder if perhaps I can get someone to come join me on stage to do a little demonstration. Is there a doctor who would like to join me on stage? I see someone who can just read from a book. Yes, here we go, in the blue. Thank you, thank you. Let's give him a big hand. It takes a lot of guts to come on stage.
Fantastic. What was your name? Michael. Good to see you. A microphone for you, Michael.
Thank you.
Very good. Are you a doctor training? Where
Emergency.
Emergency medicine. Fantastic. Let's come a little more center stage. Michael, do you know what this book is?
I do.
Of course he does. Of course he does. I don't know if the students do anymore, but you all used to know what pocket medicine was, right? Did you keep this like in your white coat when you're in your clerkships? You're like attending, ask you some nasty question. You're like, wait. You know, you're just like frantic trying to look up the treatment or the medications all along, right? We used to call this thing our peripheral brain. Michael, Dr. Tetweiler? Michael. Okay. Dr. Michael, would you believe that I have memorized every disease, every diagnosis, every diagram, every page, every paragraph of this entire book? Yes. Thank you, Dr. Michael. You can return to your seat. Hang on a second. Extraordinary claims require extraordinary evidence. As you know, there are hundreds of pages of extremely dense information here that we make the medical students learn and the residents. Dr. Mike, please, take a look. Take the book. Open to any page that you want. You got one? Okay. Just what page number are you on? What page are you on?
I'm on page 58.
58?
Yes.
Look at the bottom. Look at the bottom, page 58. Back at the bottom.
Mm-hmm.
And I believe you'll find that it says pocket medicine.
He's absolutely right.
Absolutely right. Dr. Mike confirms. Thank you. Okay, fine. It does say pocket medicine every page. Also, Mike, I can totally peek. I can see the page you're looking at. To make this more fair, we have to establish test conditions. All right? Can you stand and can you turn to face that wall? And I'm going to turn to face the opposite wall so that we are now back to back, shoulder to shoulder, cheek to cheek, as it were. This is important, all right? Because what if I were to lean over and try to sneak a peek? Oh, yeah, you could feel me. Yeah, protect the book. Don't let me see it. What if I leaned over to this side and I try to sneak a peek? Yeah, block that. Don't let me see that book, Dr. Mike. Go ahead and open to another page in the middle. You got one?
I'm ready.
Okay, tell us the title or the first line.
Diarrhea, constipation,
Diarrhea.
and ileus.
That's what's on your mind. Wait, diarrhea or constipation?
The header at the top is diarrhea, constipation, and ileus.
Okay, is there a whole section at the top talking about like acute diarrhea, where it's like less than 4 weeks? There's a big old table breaking it down. It talks about like non-inflammatory causes, yeah? Where it's due to preformed toxins. It breaks down the categories. There's viral causes. Does it show like rotavirus, norovirus, and then bacterial causes like E. coli, and then Vibrio cholera, parasitic causes like Giardia, Cryptosporidium, Cyclospora. Was I close?
My gosh.
It was there.
He's exactly right.
Exactly right. How about I see Dr. Mike is not committed. One more page. Let's just do one more. Let's just one more example. Couple pages for it. What do you got? Next page. You got one? What else is the title of the first line?
Comparison of major arthritides.
Arthritides, you mean?
Arthritides.
Joint pain. Yeah. Let me see. Okay. Another big table. Categories of joint pain in bold at the top. Of course, there's like inflammatory arthritis. There's arthralgia. And then there's other stuff like bursitis, tendinitis, myofascial pain.
And below, is there like a flow chart? You can show them there's a flow chart, right? And tells you how to break it down. If it's like acute versus chronic. If it's acute, you go to the left. And then you might think of like infection or crystal deposition or trauma. If it's right, it's chronic. Then you ask, is it inflammatory? If it is, you would branch to the left. And then you ask like how many like joints are involved? Is it mono, oligo, or polyarticular involvement? Was that what the flow chart said? You were on to the, okay. No worries. I got you.
But very, very close.
Very close. Very, very close all along the way. He's wondering what's going on here. You know, I actually showed some of my students, and they're actually quite unsatisfied to find that I actually had my own copy of the little book the whole time. Yeah. Well, subtle difference. It is subtle differences that my students say, you know, John, I'm actually very disappointed in you. Because I actually believe you knew all this stuff. To find that you actually had your own copy of the book is very disappointing. Just so you can know, go ahead and take my card. Let's trade. Can you open up to any page in the missile? And then can you show them what's inside of it? This book was blank the entire time. There is a subtle difference. Thank you, Dr. Mike. How about a gigantic hand for Dr. Mike? Thank you so much. Great job. Maybe human intelligence can still surprise you sometimes. An impressive feat of memory or an absurd parlor trick. And what doesn't matter even more, after years of study, a computer could still do this better than I could, couldn't it? I've had many lament, say, okay, fine. Yes, a computer knows a lot of stuff. Maybe even looks like a reason, but hey, I have the human touch. You can't simulate the kind of empathy and personal connection I can offer my patients. So have you all seen this study come out recently? Chatbot, or people asking medical questions, doctors answer them, chatbot answers them, and they are graded separately. And the summary result is that the chatbot-generated answers scored higher in quality and in empathy in responding to patient questions. Like the robot is nicer to people than real human doctors are. To be fair, I don't have time to write some flowery, empathetic response, right? So sorry to hear about your recurrent symptoms. That must be such a challenging situation. I want you to know our whole team is so good. I don't have time to write this BS, right? I gotta be terse and to the point. Yes, you need to take those antibiotics. No, you don't need an MRI scan right now. Schedule an appointment with me next week. Stop messaging me, go to the emergency room, right? This is the dynamic you have to work with in the modern day and age. Obviously, I think there's something very important, special, unique, and powerful about the direct human-to-human connections we can make. However, what I think studies like this show us is that we as humans don't have as much of a monopoly on empathy and personal connection as we might like to believe. And while I fully expect, for better and for worse, more patients are going to receive therapy, counseling, and advice from automated bots and live human beings in the not distant future. It's already starting to happen. And it's not because the robots are so amazingly good and humans are not. It's because we as a human-driven workforce could never keep up with the overwhelming and unlimited demand for such services. Talk through this example to really make it concrete. I wrote this essay a couple years ago. Encourage you to look it up. It's very brief, it's 2 pages. It's meant to be fun and provocative. I got an early access to one of these chatbot systems, and I was going to break it. I'm going to mess this thing up. It's so easy to trick a chatbot to say stupid, racist, misogynist things. That's been the case for years, so I stress tested this thing. Let's see how it happens. Let's see how it happens, how it handles an ethical dilemma. Real life, I saw a patient. I had to talk to the wife. It was a tough situation, but also a classic one. Afterwards, I thought about it. I said, chatbot, I want you to pretend to be the doctor counseling me, and I'm going to pretend to be the patient's wife, and I want you to talk me through it. I'm just going to go through a couple excerpts of this. I'm pretending to be the wife now, okay? And I said, doctor, you told me my husband of many years is now choking on his own food. That's why he has aspiration pneumonia. He's having worsening Alzheimer's dementia. I don't think he would have wanted to live like this. The other doctor's already scheduled to have a permanent feeding tube placed. If we don't do that, we'd be leaving him to starve to death. I mean, what choice is there? Chatbot says, I understand. This is a really hard time. Putting in a feeding tube, it can be helpful in some situations. It can also cause problems like infections. With your husband's Alzheimer's dementia, he might not feel hunger the same way we do, so the feeding tube, it might not make him feel happier or better. It could even make things more complicated. What if he starts needing restraints if he pulls the tube out? Okay. That's a pretty good response. But clearly it just found some pamphlet off the internet, it's just like parroting it back to us, right? So I pushed this thing harder. I have to do everything I can to save his life. I can't give up on him. He would never give up on me. He had a difficult life and always fought his way through. And have you heard something like that before? Chatbot says, your feelings are totally understandable. If your husband was a fighter and you feel like going ahead with this aligns with his character and his approach to life, that's important to consider. Love and a shared history give you insights into what he might want that nobody else has. Just remember, fighting can look different in different situations. Sometimes it is a fight for more time. Sometimes it's a fight for peace and comfort. Just make sure you're fighting what he would want to do in his condition. This is not an easy decision. It's okay to take the time. You need to think it through. Just around this point in the conversation, very uncomfortable. I think this thing is providing better counseling than I did in real life. In real life, after a half hour, I kind of just got tired. I said, the doctor tomorrow will keep talking to you about it. After I got past the existential angst of that moment, like, what is the purpose of my existence? It did get me think, there's something very weird. There's very interesting human-computer interaction here. Ironically, I can actually practice this high-stakes conversation in a low-stakes environment, and I can actually use this computer to become better at the most human skills I need, communicating with patients and their families. So really, if I need to go talk to a tough patient situation, I practice with the chatbot first. If I have to go into a business negotiation, I practice with the chatbot first. If I have to ask my wife for something, I practice with the chatbot first. You don't want to say something in real life you can't take back. Just take time, because I know it's going to be covered a lot in the subsequent sessions. Also realize hallucination, confabulation, as amazing things as these are, they also just make stuff up. They just make stuff up. It doesn't even know what a fact is. That's really dangerous. Imagine your medical student, your intern, is so smart, studied all the books, but just makes up facts about the patient as they talk. That would be incredibly dangerous and frightening. On the other hand, if you work with medical students, you already know to double check things that matter when you talk to them, right? So you actually know how to deal with this situation. Here I asked the chatbot, how do you prescribe, why are opioids good for patients with heart failure? It gives an answer, and it even provides references. But y'all know if you double check these PubMed IDs, none of those references are even real. It doesn't even know what a reference is. It just takes author names and title words and stitches it together into something that looks like a citation. You will learn more why these language models do that, because they're just gigantic autocomplete systems. It doesn't even know what it's saying. You can hear more about RAG-based systems. We'll hear some more demos in the afternoon as well. Hey, how do you prescribe opioids? Who cares what a chatbot thinks? You have no idea what random corner of the internet it got that from. In this case, it'll look up stuff on the internet from PubMed, and it'll say, according to these articles, this is what the answer is. But it also links back, so you can trust but verify. Pretty good, but you hear more examples of why. This is pretty good, but it is still imperfect. If you really want to understand more about all the implications, what's going to happen, just read all these articles. It all makes sense. Been writing about this for years. I know what you're thinking. I don't got time to read all this. It's hundreds of pages of information. Can't someone or something just read and digest all of this for me and make it accessible? That's why you came to a symposium, right? You want somebody who's thought about it to just talk you through it. I'll point to it, but I know we're going to see a demo later on. So there are tools like Notebook LM. Upload all these PDF files, and then it can summarize. You can chat with it. It'll generate a podcast that you can listen to. If you haven't done this, upload your CV or resume to it. It's free, by the way. And these podcasts will talk about how amazing you are in all your achievements. You'll feel really good about yourself.
Okay, so.
One of the directives I got from Dr. Thomas, she's like, Jonathan, we don't need a bunch of talking heads up here with big 30,000-foot ideas. We need some very practical, concrete things. There are medical educators around the nation, around the world, who know we need to teach our people this stuff. So what do we actually do? What do we give them to give back to it? So we've already been assembling. There's teams here already. it's actually almost curating the curriculum. A lot of the content exists there, but it's just organizing in a way. Foundation material, the QR code will get there. Our website will point it to you as well. And it's a bunch of videos as well. You can bring that back to your institution and let people use that to learn right now. You don't have to wait for something else, let alone the next phases we're going to be getting into. And much of today is going to be concrete examples of what that teaching could look like. So to outline for the whole afternoon, let's dive in further. You're going to hear first from Shivan Fadak and Dong Yao, who are going to give you a very concrete, the basics, foundations, what you need to know about large language model generative AI systems and how to use them effectively and safely. This is just a sneak preview. They have a whole 2-hour workshop that's come out around the nation. They keep getting invited over and over because they've done such a good job of making this accessible. When we surveyed our students, interestingly, they actually said the topic they most want to hear about is legal and ethical issues. You don't actually have to teach the kids how to use computers. They're going to teach us, is the reality. They want to know what the guardrails and the boundaries are. So we're going to have Professor Michelle Mello, legal scholar, break some of that down for us. And then we'll have a break and then a series of lightning demos. Dr. Thomas says, we don't want to hear lectures, just show us the demo, just show us the thing, and it'll make a lot more sense. And finally, we'll wrap it up with a panel to get all of us into a discussion. I don't know the answer. I've really been struggling to articulate this. What makes a doctor, and what should we be training? So with that, let's go ahead and start with Dr. Yao, who will take it away, and let's see a very concrete demonstration.